In line with long-established tradition, the World Health Organization promoted building a fairer and healthier world as the theme of the 2021 World Health Day, which was commemorated on April the 7th. Coming at a time of great distress for the international community as a result of the ravages of the COVID-19 pandemic, this statement would ordinarily be regarded as a rallying call to action. But for countries on the lower reaches of the global economic power ranking, many of them here in Africa, nothing could be further from reality. As a result of the obvious inequities playing out with the acquisition and distribution of the COVID-19 vaccines, nobody is safe until everybody is safe, goes the saying. But to what extent have the wealthy countries manifestly demonstrated willingness to assist the poorer ones attain relative vaccine penetration? Joining us now for a conversation around this and related matters is Dr. Francis Faduyile, a consultant pathologist and former president, Nigerian Medical Association. Welcome to the program, sir. Good morning.
Thank you very much. Good morning. It's a pleasure to be here with you today.
Good morning, Dr. Faduyile. Thank you for joining us. Very quickly, the theme of the World Health Day this year was building a healthier and fairer world. And that's understandable in the context of the challenge that the entire world faces, the COVID-19 pandemic. Now, is it possible for us to achieve, with regard to the COVID vaccine global immunization, fairness, equity, with the WHO, the WTO have been talking about? Some countries have more than they need for even double their population, say like Canada, for example. Whereas African countries, only 2% of the population in Africa has been able to gain access to one form of immunization or the other with regard to COVID-19. What kind of lessons can we draw from this? And what should African leaders do to make sure that they don't continue to hold the wrong end of the stick in terms of providing health infrastructure for their people?
Thank you very much, Ruben. I think it's important for us to emphasize that it is not in the making of the wealthier countries for them to make us less endowed. And we should not look at it as if that it is our right that they must support us. But because of inequity in the world now, we must be able to find a way to ensure that everybody in terms of health is taken care well, especially with the evolution of COVID-19 that is ravaging the entire world now. And it has also been found that almost all viral illnesses can be well taken care of by vaccine. We have had several of them that vaccine has helped us eradicate from the face of the earth. For example, the smallpox, and recently the polio virus. Now we are facing COVID-19 pandemic ravaging the entire world. And what is expected is for everyone in this world to get immunized as early as possible so that we can now control the severity and the mortality of COVID-19 as it is playing out now. And with this at the background, it is expected that those who have been able to manage their economy very well, to be able to, those who have been disciplined enough to take charge of their fate, should now look back at those of us who, well, I would say maybe somehow we are wasteful, or somehow we are not doing very well in terms of economy, and we are looking up to them to supporting us so that we can have this vaccination. And we must also impress it upon everyone that even those countries that they are well endowed, for example, Canada, they are also not having enough to take care of their populace. Just yesterday, we saw Canada going to plead or beg the Americans for them to have more supply of COVID vaccine. And we have had several cases in Germany, in many of the European countries, where they are seriously looking for COVID vaccine to be given to their populace. Unfortunately, where comes those of us who are less developed, who are as not wealthy as they are? And that is where we also need to look inward and also plead with them. Thank God we have some group of people who are coming and discussing with them for them to receive, to send some of this vaccine to us. Nigeria has had a very low, a fairly, will I say, well, about 2 million or so that was given to Nigeria to immunize its citizens, which is still a far cry from the 200 million that has been estimated. So I think it is important for those of us in Africa to find a way to look inward and ensure that we can take care of our health while we are looking towards those developed countries to supporting us, because, as you have stated, if any one of us in Africa is not properly immunized, we still stand a risk to every other person outside there.
Well, Canada ordered 5 times the number of doses that they would need for their population, and they still are facing this challenge with supply, which just goes to show it's one of many examples in life where money is not everything, frankly. There are other factors to consider. Now, when we look at this year's theme, it's building a healthier and fairer world. What steps would you advocate to achieve that in the Nigerian context and also in the context of vaccine distribution?
Thank you very much. We want to say that an injury to one, that is the masm, is an injury to all. And COVID-19, as it is now, is not respected to any race or any level of affluence that you are having. And it is in this wise that the World Health Organization has brought out the theme for this year, World Health Day. And we must be able to also appeal or discuss with these well-developed countries and strong economy to also know that everyone, every life matters. And it is in this wise that we'll continue to advocate that the supply to Africans or to Africa should also be part of the things that should be prioritized so that we can also be well immunized. And the thing we must also know is that if we leave a section, for example, Africa, without being properly immunized or taken care of at this early stage, we can have mutation that can also bring wild or other variants or strains that may be more, that may have more mortality than the current one. We have had several strains. So it is in this wise that we must look in totality of the world so that we can also have everybody to be taken care of at simultaneously so that we can make the world healthier.
All right. Why do we keep saying the West should handle South things? I mean, because these people, all they've done is to plunder all our resources through colonialism and all of that. I will sit with the question properly after the break, and you'll come back and you'll answer it. All right, welcome back. We still have, welcome, still the Rising Channel, I should say. We have Dr. Francis Fajrilla, consultant pathologist and former president, Nigerian Medical Association. So as I was asking, I said, should we keep looking at the West for everything? Oh, they'll give us vaccines. Oh, they'll do this, they'll do that. When we've seen what the West have given us all this while. It's not any better from slavery and colonialism and massive corruption. And countries like Cuba, they have 5 vaccine candidates. 3 of them are already at stage 3 trial. Soberana is one of them, and 2 other candidates. Stage 3 trial already. Countries like Cuba, then Nigeria is the giant of Africa. What are we doing? So should we be looking at the West? We have vaccine candidates too here, but it's just been lip service paid to it.
Well, your question is, I would say rhetorically, you know the answer. And the answer is obvious. It is the premium you put on what you have that will determine the output. If, for example, Nigeria, as well as other African head of states, in 2001 came out and said, look, for you to have a fairly good health system, you need 20% to be allocated as the portion for health in the budget of every year. And I can tell you Nigeria has never had beyond 5%. This current year, we are still sub 5%. And how do we dispense those money? How do we use those funds? Look, at a time, Nigeria was producing vaccine. At a time, many of our hospitals were manufacturing IV fluid. We were able to have a lot of pharmaceutical products that are being produced in the hospital in a lot of our companies. Today, what do we have? Everything is in comatose. Everything is dead. And it is because the government has not placed premium on those things. We are talking about universal health coverage. We are still playing lip service at this time and age. You see the resident doctors just went on strike on things that are just at the best put at the pedestrian level. These are things that need to be strategically planned. And we have a government who has not shown seriousness in getting the health of Nigerians right. And if we cannot get this thing right, we'll continue to depend on those who are doing very well in terms of that. I can tell you the problems are in tens or hundreds by the time you start enumerating them. And until everyone, including the government and the populace, come together and decide that enough of all this that we are doing, that is the time we are going to change and go to that side that we think will help us in this country. I'm afraid we are not looking that direction at present.
Well, Dr. Faduyile, earlier on, you used a phrase. You said African countries should look inwards. When you use that phrase, what exactly do you mean? Because looking inwards could mean different things to people. It could even be a suggestion that we should be looking at the herbal alternative medicine solution. But can you break it down for us and tell us in specific terms what looking inwards means in the context of trying to address the challenges of the COVID-19 pandemic?
We cannot in any way put a barrier to the extent of looking inward. Most drugs that are being used today are drugs that develop from the herbal drugs, from herbal medicine. And there's nobody who will tell you that herbal medicine or herbal treatment is wrong. But how well are we researching on them? How much money do we have that we are placing on herbal medicine? How well are we also exploring other or alternative medicine in this country or in this continent? We are not doing that. We are not strategic about that. And if we are doing that, we are going at a pace that is too slow for us to meet the current things that is going in the current things that are going in the world. And again, looking inward, we can say for a fact, but that when we have one or two countries that have shown that they are interested in the health of their citizens, we have seen a dramatic improvement in the health status and in the health management in those countries. One example is you have in Rwanda. Rwanda has a very high rate of universal health coverage, and what they have done is to have up to 20-25% that have been allocated to war, and the money have been judiciously used. We have Ghana that has increased its own allocation to health in the last few years, and we have seen that giant leap in Ghana's health management. And these are some of the areas we need to look at. We are having politicians, since I started understanding politics in this country, we say the same thing: health, hospital, consulting clinic, they don't have this, they don't have that. But I can tell you from what I have seen in the recent times, our hospital in yesteryears, in 10, 20 years, are better than many of those things that we're having now. We're having a lot of people that have been trained. We cannot retain them. We are having a lot of people that are doing very well outside this continent, and we cannot put those facilities in place for us to be able to excel. We have a large opportunity in front of us, and Africans must look inward. The first step was made in 2001, and today, 2021, we have not moved a single step beyond that discussion where we said 20% should be allocated to health. I was watching the television some few days ago, and they said in 1997, Qatar Airlines started with some few fleet. Today, they are about the second or third that are doing international. These are plans. These are strategic thinking. I'm sorry to call a particular airways, but I'm telling you that if we are ready, we'll sit down and we'll follow that trajectory in a direction that everybody will know, yes, Africa has emerged, and especially in Nigeria, which we have called ourselves the giant of Africa, we should be the big brother to showcase what black nationhood can do. We need all of them. We need all of us to look and see that we do things rightly.
Well, Doctor, I want to ask you your thoughts on the resident doctor strike here in Nigeria. COVID-19 has been an absolute disaster for the world, but one would have hoped that this opportunity would be grasped to sort of have more respect for the medical profession. Even Cuba, whose doctors are feted all over the world, bring in huge amounts of foreign revenue for their government. Their doctors are paid abysmally. What exactly is the problem? How does it make you feel that your most noble and most necessary of professions is constantly underappreciated?
I will pass that blame not entirely at the table of the government. It's also at the table of the people, the populace that we serve. Well, until in recent years, doctors who have been known as being noble have been expected not to embark on strike. And at those times, we believe that the populace will know that, look, this is their worth. And this is what we need to get them to be comfortable so that they can treat us. Unfortunately, the populace is not caring about what it is the lot of the doctors, and all of a sudden, a lot of things have gone underway that is wrong, and a lot of erosion into the professionalism of medical practice. And today, we have no other means than to fight for ourselves. Even the public that we are trying to protect, they are going against what the doctors are saying. For example, if I tell you the total number of trained medical personnel, both young doctors and specialists that are leaving the shores of this country, you weep for Nigeria. It looks as if what we are doing in medical training is like we are putting water on a basket that is leaking. A large number of our people are leaving. And in fact, one of the derogatory things that they say is that the best have left, meaning that those of us who are here are the second or the third level. But some of us have decided to work here. And those of us who are working here, what do we have to give to them? I'm happy that a lot of the rot that is in the health system has been brought to the fore by the Nigerian Association of Resident Doctors. And you have seen that in this last strike, in this last discussion, there is nobody who is coming out and say, look, you are asking for something outrageous. You are asking for something that is not your worth. What we have seen is that we have this problem, we have this, we are doing this, we are doing this, we are doing this. Can you explain that to patients when doctors are supposed to see patients and they are not comfortable? Can you explain that to doctors or other health workers when they get back home and they cannot take care of their of their wards and children? Can you explain that when they get contracted with some of these illnesses and they die and there is nothing that you have for them? Can you explain that in an area that you have security challenges and nobody care about who you are or what you do. And these are things that we need both the government to be sympathetic, to be empathic, and to show more interest so that the medical and other health workers can discharge their work effectively and we can have quality health services. And we need the populace to be able to talk to the government to ensure that the right things are done before we have crisis. We have some countries, and even at a time in this country, that when doctors want to embark on strike, the Labour Congress or the other civil society will come out and say, look, please continue to treat us. Don't go on this strike. We'll go on this strike for you.
Okay,
but
sir.
Today,
okay.
Everyone is from himself.
Okay.
Nobody is taking care of that.
Okay.
So these are the things that we have seen.
Okay, thank you real quickly for that. Recently, a couple of doctors in Canada had to beg the government to stop paying them too much. They said they were paid way too much. Are we ever going to get to that point in Nigeria where doctors are going to say, okay, we are comfortable? I know it might not be the case of Canada, but where doctors are going to say, okay, good job. Briefly.
Well, I don't think that statement is very correct that they said they shouldn't be paid, they were paying too much. I think what they were asking was for some of the fund that was to be given to them to be used in the system. Whichever way, these are people who have been comfortable. And we have to re-emphasize that doctors and other health workers are empathetic people. They understand the plight of people, they meet them, and they see that what is the best for them is what they should be following up. And in this country, Nigeria, I can tell you that there is no health worker or a medical doctor that can tell you that his take-home can actually take him home. It is really unfortunate. And, well, I was discussing with some of our people, because one of the major things that we scare anybody working with the government is what happens to you when we leave the government. Many of us are supposed to retire at 60, and at 60 is just getting to our prime because we get our qualification fairly later than others, and you ask them to retire, and what is the retirement benefits? What do you have for them? We have a lot of issues confronting the medical practice. In those countries, they can still engage doctors as old as 70, 75, because it is at that time that you need all the experience and they can help in training those who are coming, because everything is not about what you read in academics or what you read in books.
Well, Dr. Faduyile, on that note, we'd just like to thank you very much for joining us this morning on The Morning Show.